भाई अगर if you want to prepare for the master's exam or the DNB exam in any of the subjects, then you have to understand the structure of the exam absolutely correct. The structure of the exam is a theory, then there is a clinical, which consists of short cases and long cases, and then there is a practical exam, non-clinical exam, where they ask you about instruments, pathology, which consists of microbiology, biochemistry or histopathology, gross and microscopic, operative and X-rays, and every time you have to answer promptly, precisely and correctly. Now that is only possible if the little knowledge, out of the ocean of knowledge, the little knowledge that you need for managing your patients correctly, that knowledge becomes your reflex. What is called as kanthastha, placed in your throat. As many decisions in surgery and medicine are time critical, you have no time to think, no time to go to the library, no time to ask anybody. That is why kanthastha vidya is an essential part of being a good doctor. Now, how does this knowledge become kanthastha? The first thing is that it has to be limited to the needs of the patient. And therefore, your library is not the library of the university, but the bedside of the patient. The second thing is that you remember a thing much better if you learn it, use it, and teach it. And what you have to do here is that you have to do this repeatedly. Karat karat abhyaste jadmat hot sujan, rasari avat jatte silpar parat nisan. Therefore, you have to understand that the moment that you entered the clinical and the paraclinical side, you are a doctor and you have to behave as such. Now, there are certain components of that behavior, and they are availability, behavior, so that you can have the confidence of your patient and your patients feel happy with you, competence, and competence is by kanthastha vidya, every time reacting promptly, precisely and correctly. Then dexterity is the art in your hand, so that everything that you do, from bandaging to operation, people love it and like it for its art. And empathy. Empathy means that for all times in your life, you will keep the interest of the patient before your own. So, out of this, the competence would come if, for common patients that you see in your specialty, you can answer the following questions promptly, precisely, and correctly. The questions are: what is your diagnosis? Why do you say so? Any differential diagnosis? Why not that? How would you investigate? How would you treat? And what is the prognosis? And to answer these questions, you have to base the answers on data. And therefore, your first prerequisite is data collection as per the checklist so that you miss nothing. And every item that you fill in the data must be precise and valid. Precise means that if the examiner checks the physical sign or the investigation, he would find the same result as you. And valid means that the reporting is actually near the truth. And comprehensive means that you leave nothing. So comprehensive, precise and valid data collection with the ability to communicate and answer the questions, the 7 questions of what is your diagnosis, why do you say so, any differential diagnosis, why not that, how would you investigate, how would you treat, what is the prognosis, would make you a good candidate to pass in the postgraduate examinations. There's another important component that every time you are asked about pathology, pathogenesis, anatomy, operative, instruments, orthotics and prosthetic devices, specimens, slides, every time the clinician who's examining you would again revert to these 7 questions. Therefore, if you prepare in this manner, your preparation would be perfect. And the basic rule is that you have no time to lose. And you have to start now. You have to list the common patients. And you have to learn to answer about them these 7 questions, which are based on comprehensive, precise, and valid collection of data.